Well, let's go back to the medical questions now. We're joined in the studio by Dr. Iqbal Malik, a consultant cardiologist at St Mary's Hospital in London. Thanks very much indeed for joining us.
Pleasure.
Lots of questions, of course, being asked there and here. First of all, the terminology we're using. Cardiac arrest is the phrase being used, we understand, in the death certificate. Is that actually different to a heart attack?
A heart attack is one cause of a cardiac arrest. Cardiac arrest just means that your heart stopped.
Right.
Many different reasons for that, one of which, the commonest one in this country, is that you've blocked a blood vessel in your heart and you've had a heart attack.
So the blood's just not being pumped around by the heart?
Blood's not being pumped around, and that produces rhythm disturbances as well as pump disturbances. Your heart stops, and it can be fatal.
Yeah. Now, in terms of the painkillers, pethidine is the sort of generic name. Would that cause any specific problems in terms of blood clots or the rhythm of the heart?
That particular painkiller doesn't actually cause blood clots, but what it can do is suppress your breathing. And so if your breathing stops, you run out of oxygen. That then affects your heart and, of course, your brain, and that can set off a cardiac arrest. Now, Micheal Jackson was found lying in his bed. If he'd had an injection of pethidine, which was perhaps too strong, or the cocktail of drugs was too strong, that could have just knocked him out completely. He stops breathing in bed. He's found at some stage later when his heart's already stopped.
Yeah, I mean, there's a fairly comprehensive list of other things that he was supposedly taking. Of course, this is still unofficial, but they've talked of diluted Vicodin for problems with his pain, Soma, a muscle relaxant, Xanax, a sedative, Zoloft and Paxil, antidepressants, and Prilosec for heartburn even. Now, could that actually affect the performance of the heart or the way that the body deals with all these things?
Yes, I mean, I think a cocktail of antidepressants, certainly if they're combined with other drugs that raise their blood levels in an unfortunate way, can set off rhythm problems in the heart. If your heart suddenly goes helter-skelter, I'm sure we've all seen ER with that wiggly trace, that sort of ventricular fibrillation means your heart is not functioning well and you've had a cardiac arrest. Could have been that. We know that some drugs taken over a long period of time can increase the risk of clots forming. If those clots form in your heart blood vessels, that sets off a heart attack. That could set off the cardiac arrest.
Because it is said that perhaps he was hooked on one or two of these prescription painkillers. What sort of length of time would it be for physical problems to build up to manifest themselves?
I think once you've started taking them for a few months, already problems can arise.
Really, that short a period?
That short a period. Yeah. These painkillers, if they're taken long-term, can have effects on the kidneys as well as the heart.
And in terms of finding out exactly what happened now, we understand the toxicology tests will take some weeks, although the autopsy has taken place. Will they be able to trace back the sequence of events from that?
I think the only thing they'll be able to tell is what he was taking acutely. You can look at hair samples and things which will tell you what drugs he's been taking over a number of months and years beforehand. The traces remain. But I suppose the acute post-mortem findings would have said, obviously, if there was a heart attack. Perhaps not the cause of the heart attack, but if a blocked blood vessel was there, you can pick that up straight away. It's just that information hasn't been released.
Yeah. In terms of his personal physician, said to be a live-in doctor, he was a cardiologist. Now, does that strike you as being unusual in that, obviously, we think of just GPs? I mean, could there be an indication that Jackson knew he had some particular problems?
It may be, although, you know, cardiologists tend to be at the sharp end of the spectrum, and therefore if you're particularly worried about acute emergencies occurring, you might choose an emergency physician or a cardiologist to keep with you. And the lifestyle of the rich and famous lends itself to that.
Unlikely one would think that a man who'd been so active at the age of 50 would actually have any inherent heart disease.
I'm not sure that's true. He's not had the standard lifestyle, has he? I think there must have been some partying going on. I don't know whether he was a smoker or not, but certainly stress was tantamount in his life, and we know that stress can set off heart attacks. 50% of heart attacks occur without any warning. No symptoms of angina before that. The first thing you know is you've had a heart attack.
So, because in fact he had, I think in March, a 4.5-hour physical examination ready for this tour.
Right.
So he could well have been cleared then, but if stress builds up,
yeah,
the trigger goes, and that's that.
Yeah, it's the same as suddenly playing a game of squash at the age of 50 when you haven't played since 20. That very sudden change in activity that can set off events even if you begin all clear a few months ago.
And even if you're a superstar.
Yeah.
Dr. Iqbal Malik, thank you very much indeed for your expert opinion. Thank you.